Good morning, Dr. McHenry coming to you to discuss CLEERLY. CLEERLY is an advanced imaging modality to screen for atherosclerosis or heart disease. CLEERLY's purpose was to create a world without heart attacks. With heart attacks being the leading cause of death, we need better means to assess risk and determine who is at risk. Their mission was to establish the global adoption of a new standard of care for precision heart care for everyone. Advanced imaging has been historically used to prevent the most common causes of cancer, such as mammography for breast cancer, colonoscopy for colon cancer, the chest x-ray or lung CAT scan for lung cancer. But cardiac care has not. Cardiac care has essentially relied on surrogates of disease, such as cholesterol levels. Unfortunately, 70% of people who suffer heart attacks have normal cholesterol. If we rely solely on symptoms of heart disease to present themselves before we do an intervention or screening, 50% of those having heart attacks felt no symptoms before the onset of the heart attack. Additionally, stress testing, although the standard of screening, 75% of heart attack lesions can be missed by stress test. Additionally, not all plaque is the same. Doing a standard CT angiogram and finding plaque does not mean true risk, as there are different types of plaque. There are high-risk plaques, intermediate-risk plaque, and low-risk plaque. CLEERLY has the ability to not only determine if there is plaque, but the type of plaque and track the progression of the plaque or the regression. CLEERLY's digital care pathway simply identifies who is at risk through standard risk factor assessment. We then get the CLEERLY testing done to define if those people at risk truly do have atherosclerosis and what type. Then we can educate the patient on this. We can then institute treatment based on algorithm-enabled therapy through the CLEERLY analysis. And over time, we can track the disease rather than surrogates to prove therapeutic success over time, thereby preventing heart attacks and the progression of heart disease. CLEERLY is very seamless. It's simple to do. I simply have a discussion with you. We decide if you're an appropriate candidate. We write the orders. The CT angiogram is performed. The data is then securely uploaded to CLEERLY, where they do their artificial intelligence analysis of the data of the CT images. Subsequently, we identify, is there plaque present? Not only plaque, what type of plaque? To the highest accuracy, 99% accuracy versus established gold standards. Rapid turnaround time on the images. We obtain the report shortly after the images are done, and then we review the report with you. CLEERLY defines vessel by vessel detail, precision detail of each artery and branch with the degree of stenosis quantified down to the single digit, and also assesses for vascular remodeling scores. You get a comprehensive plaque assessment and a stenosis scoring showing which of your vessels have narrowing down to the single digit percent. CLEERLY provides an outstanding educational packet for the patient showing all of their results, the types of plaque present or absent, and the interventions possible to halt this disease progression. American College of Cardiology treat the disease algorithms are then utilized based on results to determine how aggressive therapy needs to be. Over time, with further analysis after treatment to determine if there's been disease stabilization or disease progression. Based on those two outcomes, we decide if therapy needs to be even more aggressive. So we determine amount of disease, type of disease, and we can track the progression of the disease over time or prove regression due to the interventions and lifestyle modifications. Tracking, as we said, quantitative disease tracking, side-by-side comparisons of the previous images with the current images after therapeutic interventions, showing plaque transformation, a lesion level analysis. Each specific area of plaque can be analyzed to show its changes over time. With this, CLEERLY is able to definitively establish who is at risk for heart attack, who is not at risk for heart attack, those who are at risk for progression, those with dangerous, unstable type plaque, and we can therefore institute the best therapeutic interventions to prevent heart disease. If you feel CLEERLY is an appropriate test for you, or if you have further questions on whether CLEERLY is a test you would like to have done, please reach out to the office and schedule a consultation with me. I am reviewing the appropriateness of CLEERLY at everyone's physicals. Currently, CLEERLY is not insurance covered. It is FDA approved, and it does have a current price tag of $1,500. For those at risk, I believe this test is well worth the cost to determine if you truly have the risk that we think may be there. With that, I thank you, and if you have questions, please contact the office.